Good afternoon. My name is Bill Watts. I'm a Desert Storm, Desert Shield combat veteran from the 1991 Gulf War, serving with the 1st Cavalry Division 4588. Presently, I'm an advocate for veterans' health care and quality of life and volunteer as Director of Fishing with America's Finest as a nonprofit that helps veterans using fishing therapy. I would like to welcome everyone to Veterans Helping Veterans Midday Talk. Gulf War Illness and Research. Joining me today as my co-host is Elizabeth Balbin, Special Projects Director at the Institute for Neuroimmune Medicine at Nova Southern University. If you would please notice within your control panel, there's a Q&A tab. If you have any questions, please type it within that panel, and our speakers will do their best in answering all your questions. Also, we will be having a Q&A portion at the end of the webinar, if you'd like to hold on to your questions until then. I want to thank everyone again for joining us, and I will begin by introducing my co-host, Elizabeth Balbin.
Thank you, Bill. So this is our first webinar, so please bear with us in case we have any little bit of issues. But the one thing I get to do, which I'm very happy to do, is to introduce Dr. Nancy Klimas. Dr. Klimas is the director of the Institute of Neuroimmune Medicine and the director of clinical immunology of research at the Miami Veterans Medical Center. A little bit about her background: she is a professor at the Dr. Karan Patel College of Osteopathic Medicine, and she's the chair of the Department of Clinical Immunology at Southeastern University. She's also the dean at the medical school, and she is the director of the Institute for Neuroimmune Medicine. But mostly, and Dr. Klimas is one of the leading medical authorities on Gulf War illness and is an advocate for all veterans, and I feel very honored to present her today. So, Dr. Klimas?
Thanks for having me. I've been asked just to do a little background on Gulf War illness in general, and a real quick one because there's a lot going on in this very short time. And there's a bunch of people on. It looks like we got 23 people on already, and the people keep popping on. We're going to be reviewing some of our research goals and some of the exciting things going on in research today. But for those of you that are new to the world of Gulf War illness, it's a real deal. And one veteran in 3 that came home from the Gulf War in 1991 became ill and remain ill to this very day. 1 in 3, that's a lot. And it's thought to be because there were so many toxic exposures that veterans experienced in that particular deployment, that it put people at great risk for developing a neurologic injury that causes neuroinflammation, brain inflammation, and oxidative stress in the brain. And all of that up there is causing all of this down here that make you feel pretty darn lousy on a day-to-day basis. So there's a lot of new knowledge that's been gleaned in the last 8 or 10 years, and particularly the last couple of years, to prove all that. And our science has moved us and galloped us towards interventions now that are finally focused on what's actually wrong versus just trying to manage symptoms. So I'll just leave it at that and let this noontime conference go on.
Thank you for that. So what we do at NOVA, and we're lucky to be able to do that, is to have an integrative approach to looking at Gulf War illness. And we work with a really neat group of people. Some of them that are here today that you're going to hear from, and then a few other people that are not here. And as you can see, that's a picture of our group in front of our institute at NOVA. And we have a couple of researchers that I just want to mention that are not with us right now. One of them is Dr. Aman Shima, who's currently the program director for Research Operations Center, funded for the Gulf War Illness Clinical Research Trials and Intervention. And another person is Dr. Deborah Cohen, who's running the phase 3 clinical trials for CoQ10 for veterans who are diagnosed with Gulf War illness. Part of our team is comprised of nurses, Fanny Collado, who oversees a team at the Miami VA Medical Center, and where a lot of our research takes place, and also at Nova Southeastern University. And we just wanted to reach out to everybody and to let them know about some of the neat things that are happening in research and why it's so important to have people participate in research. And we just wanted to have this forum where you could meet some of the people that are conducting this research and be able to ask those questions at the end of our talk. And, you know, maybe we could answer some of the questions you might have about what does it entail to be part of clinical research at Nova. And with that, I'm going to pass it on to Bill. Actually, before I do that, I do want to mention, many of you took part of our survey study, and if you haven't, the survey study is a study that's helping us to find out where veterans are around the country that might have been exposed to Gulf War illness, and so we have some information here how you could take part of it. And with that being said, I'm going to pass it over to Bill.
Oh, thank you, Dr. Klimas. Thank you, Elizabeth. Several years ago, while I was at an appointment with my primary care doctor, she recommended that I see Dr. Klimas for my chronic fatigue and fibromyalgia. Upon meeting Dr. Klimas and being thoroughly going through a physical with her and given my diagnosis, I was informed about several different research projects that was going on here in Miami, if I would be interested. Upon my first visit, I found this to be very interesting and have been through several of the research appointments and seeing benefits of helping other veterans. I began volunteering for several committees all over the country, thus beginning my advocacy. It's now my pleasure to introduce Ms. Precious Leets, who will be discussing what to expect when you participate in research. Precious?
Yes, so good afternoon, everyone. Thank you for being here. I'm excited to talk to all of you. So one of my roles is coordinator in regards to our research. And research can sometimes seem scary, especially when you think about it in the sci-fi world and you think about Dr. Jekyll and Mr. Hyde or Dr. Frankenstein. But it's so not the case. We have an amazing research team, and they're here, and it's all about the veterans. And so today I want to talk to you about the different things that'll happen or what to expect when you come for a visit. Now, before you even come to the visit, we do what's called a pre-screening. And that means one of the coordinators will talk to you and we'll go through a phone screen to make sure that you're eligible to participate and to determine which study would be best for you. Once that is done, the next thing, and that screening takes about 10 to 15 minutes. After that's been completed, the next thing we'll do is we'll let you know the date, the time, and the place that you need to come. Usually our appointments are given in the morning, and that's because there will be some screening labs that need to be done, and we ask that you come in fasting. So then the next thing that we do is you're going to come to the VA or to one of the other clinics to be seen. And you will be welcomed again by one of the coordinators. And when you come, with COVID-19 and everything going on, when you come, you will be asked to make sure you have your mask on. And there will be, when you come into the building, they'll take your temperature and ask you some questions just to make sure that everything is safe. Along with that, you come in, the coordinators will sit you down and they will give you a consent form. In that consent form, it tells you everything about the study. It tells you, what you're going to be doing, how you're going to do it, how long the study is going to last, and you'll be reading that with the coordinator. If you have any questions, the coordinator will answer them for you. And as long as you have no questions, well, then you'll sign off on the consent form, and then you move on to the next step. Now, depending on which study you're going to be in will determine how many visits you have. But for all of the studies, that very first visit is approximately 3 to 4 hours. And the reason is because there's the consent signing, there's the screening labs, there's some questionnaires, as well as cognitive testing. And the coordinators will walk you through all of that. Along with that, there's also a physical. Now, the screening labs, once they come back, if you'd like to have a copy of those, all you have to do is ask us, and we'll be more than glad to get that to you. Okay? Now, depending again on which study you're in, there's also an exercise component. And we have our exercise physiologist who's going to talk after me to give you a little bit more detail. But on the day that you would come for exercise testing, that day is going to be a little longer. It's about a 6-hour day. And that reason being is because there's different time points where blood is taken, and you'll have to wait a certain period of time before the next set of blood is taken. So after that's done, there's the physical, and we have, again, Fanny Collada, our nurse, who will do that. And once everything is done, we will schedule you for your next visit. And usually that's about 2 weeks after your initial visit, because we need to get the screening labs back. And then after that, so also something, when you're doing your exercise testing, we will let you know to come in wearing comfortable clothes, and anything else you may need to know, we'll let you know that. Depending on, again, which study you're in, you may be receiving a Fitbit. And the Fitbit is used to measure your exercise, your level of exercise. And that is something that we give to you. That's yours, free to keep. Another tool that we use is a Actigraph, and it's another tool for measuring your exercise as well as your resting, the measurement of you resting. And so the study's all done. You've went through all the stages, and at the very end, if you would like, again, you can get the screening labs. There is compensation involved, so you would receive that. But also, for any of our veterans who take that challenge to participate and they finish, they will receive a challenge coin. I think Bill has his with him. It's a way of saying thank you to help your other veterans out. And just by, there it is, and by participating in research. That's pretty much the gist of it. And at any time you decide you do not want to participate, all you have to do is let us know. This is totally voluntarily, but please know that it's all about helping each other and helping us to help you. So thank you. And Bill, back to you.
Okay, thank you, Precious. Next up is Jeff C., because I don't want to murder his last name. He's our exercise physiologist for Gulf War research team. For those who participate in some of the different researches, you'll be meeting Jeff and some of his special equipment he uses. The cool one is where you get to go bowling by breathing. I've yet to get a strike on that one. Anyhow, Jeff, take it away.
And thank you very much, Bill. And the last name is Knoyer, so I don't ever expect anyone to be able to pronounce that correctly. So I think Jeff C. was a perfect way to go there. And by the way, that coin that you guys have is awesome. I don't think I've ever actually seen it in shiny and in person like that, so I think it looks really cool. Anyway, my name is Jeff Knoyer. As they were saying, I am the exercise physiologist that works with all of the research studies that we have currently at the VA and some of the ones that we have coming up at Nova Southeastern as well. I am the one that you're going to see that's going to be taking you through all the different exercise tests that we have available. I've been able to work over the years that I've been working with the Institute for Neuroimmune Medicine. I've tested hundreds of veterans and patients With the equipment that you're seeing on the screen right now, you know, we get people up on this bike. You get to wear a mask. A lot of people like to take pictures while they have the mask on and all the wires hanging off their face like they're some villain from Batman or Superman or whatever. I think it's Bane. I don't know. But you know, everyone always likes to take pictures because it looks like they're doing a lot of things. And it's you know, the actual exercise test, I usually like to think of as kind of like the main event of the whole thing. You know, we like to guide everyone through these exercise tests, you know, so that we can get a lot of great information, and it can be as safe, effective, and informative for all of our patients as humanly possible. You know, so again, what we do is we get you up onto this special bike, and we put you on a protocol, which we call a ramped protocol. And this ramp protocol makes it feel as though you're pedaling up like an increasingly steeper and steeper hill. And we ask you to pedal for as long as you can. The longer you pedal and the more information you're able to give us, the better the information we'll be able to put into our research study and be able to give you back in the process. So you see all the wires on this computer, again, on the screen. All these wires are leading back to something that we call the metabolic cart. And the cool thing about the metabolic cart is that, first of all, yes, you do get to go bowling with your breath. That is, you know, one of the fun parts. We also have a couple of other ones. There's a flying toaster game. I don't know why they thought of it, but I think it's fun. And we are able to test your lung capacity. And we do that before each individual exercise test, just to make sure that, you know, your lung capacity is there, and just to make sure that, you know, we have all the numbers set up in the right way. So there's that. Plus, the nice part about the metabolic cart is it's measuring every single breath that you take. So that means that with literally every breath you take, we're able to see what changes are happening in your physiology. And then the nice part is, you know, with as with all the other tests and everything like that, we can print out this information for you on the day of, or, you know, we can make sure that we get this report to you very quickly thereafter the test if you'd like it. And I can sit down, and usually I like to do this for all of our veterans and for all of our patients. I can sit down and explain to you exactly what's going on throughout all of the exercise tests, all the changes and everything like that. And one of my personal favorite things to do is, after your very last exercise test, some of the studies have multiple exercise tests. After your very last exercise test, I get the chance to sit down with you and give you advice on whatever fitness goals you have, whether it's being able to finish a race, being able to lose weight, being able to gain weight, gain muscle, gain strength, whatever it is. We can sit down and we can talk about the steps that we can take to be able to do that, as backed up by all this incredible data that, once again, we get on a breath-by-breath basis. It's a tough thing to say that 10 times fast. Anyway, thank you all very much for all your help. Thank you all for participating, and thank you all for your interest. I believe that's about all I have to say. I want to give time for everybody else. So, Bill, I'm going to hand it back to you. And once again, thank you very much.
Thanks a lot, Jeff. Just to remind everybody, if you haven't found it so far, the Q&A is located on my computer at the bottom of the screen. I have been seeing questions come up, and Dr. Klimas has been answering those as they've popped up. So this actually brings us to our next topic: experiences when participating in research. I suffer from anxiety, and I'm sure a lot of you do too. So the first time I came to research, I was nervous about what to expect. The team clearly explained everything that was going to happen and relaxed my fears of the unknown. As I stated before in my first involvement with research, I found that I really, really enjoyed this, and I could use it as a way to help others. During the different approaches, I found medications and being more active, as Jeff was saying, to help reduce some of my symptoms to where I have some quality of life. I have another Gulf War veteran here with me today. Jimmy Arocha is a research associate at the Institute for Neuroimmune Medicine. And I'd like to share some of his experiences in participating in the research. Go ahead, Jimmy.
Thank you, Bill. I appreciate it, and thank you for the webinar. I think it's a great idea, and I think it's an awesome way to help our Gulf War veterans prepare for not only participation in research, but also to take a little bit of a step back. And we talk about our experience. I can share with you as a volunteer and participant of Gulf War research, the most important component that I received from it was just learning a little bit more about what was going on with my body. That was the scariest part. I know I was ill and was having somewhat challenges with my patient aligned care team or my primary doctor in understanding what was going on. And fortunately, I discovered this team. Very, very valuable component, very valuable experience. When I discovered the team, I immediately launched into Gulf War research and started to learn these things that were going on in my body. And what it did is empowered me, because then I was able to take the information, and the researchers are subject matter experts. They're going to share with you what they've learned and what it means to you. So I was able to come back to Orlando and share those discoveries with my primary care doctor and my patient aligned care team. There was nurses, RNs, a whole crew of folks there, and they listened, and I gave them handouts, and in response, what they did was they were able to, once they fully understood what was going on, they did the next thing, and that was to refer me to specialty care in the Veterans Administration, the Veterans Health Administration, the VHA. Very important. And when I started seeing specialty care, and I just share with you, that was a neurologist, I was gastrointestinal doctor, it was a pulmonary doctor. So, you know, these things, these areas of specialization are very important because they start resonating around what Gulf War illness is all about. When I learned these things, then I was extremely empowered to then continue on in my endeavors for healthcare. So that's my first, in my initial need was I need healthcare, and expecting that Gulf War illness is going to require a lifetime of healthcare. That was important. And then secondarily, I also pursued my benefits, my compensation and pay benefits for my disabilities. Again, knowing and understanding what was going on with my body, also learning more from the researchers in that regard, and then being able to focus that on specialty care, that allowed me to move forward. And what I've learned in a few years is that the environmental conditions of the Gulf War, you may say, well, what environment, Jimmy? Well, what about dust? What about sarin gas? What about pesticides? What about these prophylaxis that we use to prevent nerve agent poisoning, like pyristamine bromide? These things are all very, very important in my understanding what a toxic wound was about. And that pretty much opened up my understanding of what Gulf War illness was, and then how to develop a plan around that understanding that would provide me, like Bill said, quality of life. It's very important that we fall back on quality of life. And that's my experience. And thank you again, Bill. And I'll pass it on to Ms. Elizabeth Balvin.
Thank you, Jimmy. I just want to say having Jimmy and Bill as part of advocates working with us through our clinical research has been an amazing experience. So thank you very much for doing that. Next, I want to introduce Sina Kirby. Sina is a program manager for the Gulf War Illness Clinical Trials Intervention Center, known as a WICTIC, and which is being conducted at Nova Southeastern University. Zina, will you tell us a little bit about the research that you're doing? Zina, I'm going to ask you if you could start over and unmute yourself. Thank you.
Thank you. I have a note on my screen. I still forgot. I appreciate that. Okay. Yeah. So as Ms. Balvin said, my name is Zina Kirby, and I'm the program manager with the Gulf War Illness Clinical Trials and Intervention Center, or GWICTIC, at Nova Southeastern University. So I do want to thank everyone again for being here today. We really appreciate everyone joining us to learn more about the research we have going on. So to give you a bit more background about the GWICTIC, we received our funding in 2008 when the Department of Defense awarded an $8.5 million grant to Dr. Klimas to establish the GWICTIC to serve as a new mechanism for clinical trials in Gulf War illness. So we at the GWICDIC strive to develop effective treatments to both improve outcomes and quality of life for our Gulf War veterans suffering from conditions related to environmental exposure within the Gulf War. So at the GWICDIC, we have studies across the country targeting different areas of concern within Gulf War illness. These studies use FDA-approved drugs at FDA-approved dosages, as well as over-the-counter supplements. Some of the different sites our studies will be occurring in are Southern Florida, where I'm assuming most of you are familiar with our research from, if you are, as well as California and Boston. We'll also be having a number of virtual studies that can be completed remotely, which I know is growingly important in these uncertain times. So even if you live far from one of our study sites, you may be eligible for participation in these virtual studies or reimbursement for travel to and from your home to the study site. So we do welcome both those with and without a diagnosis of Gulf War illness and those with and without symptoms. Participation in this research, as Jimmy said, is intended to educate and inform the veterans about their own health. And that way, this may lead to improved conversations between veterans like you and your primary healthcare teams. The first study that we're going to be starting within the GWICDIC is our homeostatic reboot study. This is under Dr. Nancy Klimas and is intended for treatment of symptoms associated with your deployment in Operations Desert Storm and Desert Shield. So you can find more information about this specific study on our website. You can see the link is up on the screen. You can also find information about that on clinicaltrials.gov. Of course, if you want a personal touch, you can always reach out to me directly. I have my phone number on the screen is 954-262-2870. And you can also shoot us an email at gwictic@nova.edu. So if you or someone you know served in Operation Desert Storm, Desert Shield, please do reach out to us. We are actively looking to recruit both those with and without symptoms of Gulf War illness to participate in our current phase of research as well as upcoming clinical trials. So again, please feel free to give me a call. My name is Zena and my phone number is 954-262-2870. Thank you again for everyone who came today, and I'm gonna give it back to Ms. Balvin.
Thanks, Sina. So now we're gonna talk a little bit to Precious Lees Gutierrez. Precious is officially the research coordinator and national recruiter for our Gulf War illness research studies. But better yet, Precious is a person that you can call at any time, and she will be more than happy to talk to you about each of the studies that we have going on and explain to you in further detail what it takes to be a part of each study. She'll also do the screen and some of the scheduling. So her phone number is a number listed below, and we also have an email, and she will personally take your call and she will personally answer your emails about any study you might have. So with that being said, I'm going to pass it over to Precious and she can give you a little bit more information.
So thank you again, Elizabeth. And everybody that's spoken so far, thank you so much for participating in this, and thank you for everyone that's listening. So like Elizabeth said, not only am I a coordinator, but I'm also the national recruiter for our Gulf War illness studies. And I'm really passionate about doing this because I come from a military family. I am the dependent of a veteran. So yes, I'm a military princess, not a military brat. But my father served in Vietnam. He was part of the 173rd Airborne. And later, when we lived in Fort Bragg, I believe he was part of the 82nd Airborne. Not only that, I have 4 brothers who are also military, 2 of them who served in Afghanistan and other places that they weren't allowed to tell us where they served. Now, to this day, my father is still suffering from the symptoms of Agent Orange. And I wish there had been someone or something like this that could have helped him. So for us, the whole team, helping our veterans to live a better quality of life is dear to my heart. And, we're here for the veterans. So today, that's why I'd like to talk to you about some of the studies and clinical trials we have going on at the Miami VA. Now, the purpose of our research is to help us better understand and be able to diagnose Gulf War veterans' symptoms. In order to do this, we need men and women veterans that have the symptoms of Gulf War illness, as well as, like Zena said, those are healthy or sedentary. So these are just some of the studies that we have going on. And the first one I'd like to talk about is a study called Cells to Therapy. Now, our studies range from 2 days and 4 hours, a study that it goes on, it's a 4-hour study over 2 days. And then we have some that last as long as 16 weeks with approximately 8 visits. So all of our studies, we are more than glad to work it into your schedule. We'll make it work to where it's convenient for you. Now, the Cells to Therapy study, we look at the therapeutic effects of drugs that impact the specific list of therapeutic targets and that are based on prior research. Now, this study is being done at, again, the Miami VA, and we really need male veterans that are healthy or sedentary healthy. Along with that, we have studies also for women. So the next study is called Women versus Men with Gulf War illness. Now, this is one of the studies that actually has an exercise component. And what's so amazing about this study is there's a technique being used called microarray. And what it does is it measures expression levels of large numbers of genes, and it helps us to better understand and identify the likely causes of Gulf War illness. It also allows us to study genes that affect how the body reacts to exercise, to rest and exercise. So again, that's where the exercise testing comes into play, as well as 2 of the tools we use, like I said earlier, the Fitbit, as well as the Actigraph. So for this study, if you're interested, we need women, and we need healthy women or sedentary healthy women. For this study, even though it's being conducted here at the Miami VA, we are accepting some women who may be close by. I would just need you to call me and we can talk and figure out if you're eligible and how to get you into this study. The next study I'd like to talk about is with 2 different supplements that have been shown to quiet inflammation. And what's amazing about this study is it's a randomized double-blind placebo with these 2 supplements. The supplements you may have heard of are glutathione and curcumin. And with these 2 natural supplements, this study, you'll either get the placebo or the glutathione or the curcumin. And for this study, we need Gulf War veterans that are, who are suffering from Gulf War illness. We also have other studies going on that are multi-site. We are collaborating with Boston University, Palo Alto out in California, as well as some other states. We also have virtual studies that we're just waiting on approval to get those up and going. Now, when I was talking earlier, I forgot to mention that when you participate in research, everything is confidential. You'll sign a consent form, but after that, you're given a study ID. And unless you tell someone, no one knows who you are and that you're participating in research. Also, research does not affect your benefits. It doesn't have anything to do with it. So please do not be afraid that if you're waiting on a benefit claim or something that you can't do research. That's not the case at all. So again, if you're eligible and you're willing, you'll get your screening labs for free. There's no cost to you when you participate in research. Like Jeff said, the results from the exercise test, if you want that, we'll be more than glad to give that to you as well. And then again, that beautiful challenge coin. And like Elizabeth was saying, we're here for you. So if you have questions about anything, we may not know the answers, but please call and we'll try to figure it out. If you want to call and just say hi, that's fine too. Again, my name is Precious Leaks Gutierrez. My number is 305-275-7648. And our email, vhamiagwi@va.gov. Again, there's an amazing group of people who are here to help you. And we just ask that you help us to help you. And like Jimmy and Bill said, it's about education. It's about helping veterans live a better quality of life. It's about leaving no one left behind. So again, thank you. And I believe, Bill, is it back to you?
Hi, Precious. Actually, I'm going to take it over. So I think we're going to start wrapping it up right now. And one of the things we're going to do is we're going to do our question and answer portion of it. Below you have a box where you can type up any questions. We've been answering some of the questions online already, but I'm going to read some of them out loud just because I think some of them have a common context that we keep hearing. So the first one I'm actually going to give to Dr. Klimas, and this question has already been answered, but maybe she could talk a little bit about it. It says, I served in Desert Storm, Desert Shield in 1990 to 1991 and was diagnosed with myasthenia gravis, having a very difficult time. Does this diagnosis fit into VA Gulf War illness? And are there any other clinical trials? Also, is myasthenia gravis a common diagnosis of Gulf War veterans? So Dr. Klimas, can you answer that for us?
Sure. And Arthur, thank you for asking the question. And I'm going to broaden it a little bit because people who sign up for studies don't realize sometimes that we have entry criteria that can be very rigid or very broad. And it sort of depends on if there's a good reason for that, you know? So myasthenia gravis sometimes would be excluded, but sometimes it would be included in a study of what happened to veterans after the first Gulf War. I think I answered this question, you know, and you see what I said. But there's some very important work that's been done just in the last few years that has proven that Gulf War veterans have autoantibodies against various targets that are in their brain or in their nerve endings or in the nerves themselves. And the myasthenia gravis is an autoimmune condition of the central nervous system. And so it fits into this general category. And it makes sense that your deployment to the Gulf War could have injured the tissue in a way that your immune system saw it and attacked it and then created a long-term memory response for attacking you, self, instead of just attacking, you know, viruses and bacteria and stuff like that. So I think it's very reasonable for you to be wondering if this was a result of your Gulf War time that you developed myasthenia gravis. That makes good sense to me. I've seen a number of myasthenia gravis Gulf War vets. Many of them presented very early after deployment in the first 10 years. Not so many in the last 10 or 15 years. But I think it's true that you could make that link. Now, whether or not you fit into clinical trials or not is really such a good question because, again, it depends on the reason. You'll fit into all the survey type of studies because we need to know the broadest kind of thing we can learn about what happened to veterans. But when there's intervention studies, sometimes myasthenia gravis has such a clear known treatment that using an experimental treatment wouldn't be in your own best interest. So signing up for, you know, intervention studies that could do you potentially risk instead of help would not be in your best interest. But the other thing to remember when you don't fall in a perfect way into a particular study, hey, you're having some help from my granddaughter. The teleworking is wonderful. When you don't fit into a study, a particular study, don't be upset or frustrated. What we learn from that study is going to help you. And that's the whole point of doing the study. We want to be able to help everybody, not just the people in the study. And we really appreciate the volunteers in the study because you're doing this for everybody else. What we learn from these studies are so critically important to be able to roll out care in a broad way at every VA. And the other thing that's interesting about this, and many of you have been on the RAC, there was a RAC meeting this week, and they get on the phone and they're so frustrated because they haven't been able to find an expert at their local VA. Well, one of the reasons why there's no local experts is that we don't have a guideline-driven, evidence-based, perfect way to treat patients. And how do you train the doctors at every VA on what to do with Gulf War illness if we don't actually know? We have to do these research studies, and then we develop from that the training modules that make every VA doctor know what this is, and then develop some experts within every VA so that they can take care of you when you show up. So I answered a lot of other questions in your question. Sorry about that, but they come up a lot, and I think that it's important to go over that kind of thing.
Okay, our next question is a couple of people have asked us, are we doing a research only in Miami and Florida, or are we doing research throughout the country? And I guess I'm going to let Precious and Zena briefly mention about the web-based studies that we have going on right now.
So yes, we are accepting veterans from all over the country for various reasons, because we do have, like I said, multi-site studies going on. And there is, like I said, sites out in California, Boston, and various other places, along with the web-based studies that we're waiting for approval on. And once those are approved, it doesn't matter where you are, you'll be able to participate. So yes, please, if you're interested, let Zena and I know, and we'll talk to you and give you more information. And Zena?
Right, yes, so basically same thing Precious said. Right now, what we ask you to do is that online-based survey study. This will kind of, if you allow us, will allow us to contact you about different research opportunities that may be coming up. The research within the GWICTIC will happen across the country. As they are saying, it's California, so that's at the Palo Alto RISC, as well as in Boston University, as well as the virtual studies. These will be coming up in a few months or a year, depending on the progression of the first phase 1 of the study here down at Miami. So very excited to get started with the virtual. So if you're interested in that and you're somewhere that's not Southern Florida, please do take our survey, and then we can get you connected with all of the different opportunities.
Yes, thank you. And before I pass it to the next question, the survey study, one of the things that it allows us to do is to find out where our veterans are at in order to be able to get more research in those areas. So if you haven't done the survey study, please take the survey study and let other veterans know. And we were just approved for a follow-up study, which is probably going to start in the next couple of weeks, and you'll receive the link to that. Bill, do you have our next question?
Sure. I have RRMS. I was curious because I had an episode where the world just started spinning and all the Army did was just a vision test. I've had dizzy spells on and off throughout the years before I had a major episode and was diagnosed. Is there any way to find out exactly if this was from my time in the Gulf? I'm afraid I could have possibly passed it on to my son. Dr. Klimas?
Yeah, and I answered this in the chat room as well. But RRMS is relapse MS, multiple sclerosis, and it's an autoimmune condition. So just like myasthenia gravis in the first question is an autoimmune condition, MS is an autoimmune condition. And there's a theme going on here that we're hearing of Gulf War veterans with brain-related autoimmune conditions. Now, our group is participated with Dr. Sullivan and Dr. Abudonia in a big study measuring hundreds of veterans' bloods for autoantibodies against brain different target tissues in the brain. And we found a pattern in Gulf War illness that was far and above anything we saw in any of the other sick control groups. So that paper is just being submitted for publication. I just was reading the draft of it yesterday, but it was a very impressive level of antibody being produced in Gulf War veterans. It would explain how you could still be sick, 30 years later. What happened 30 years ago? And the answer would be that you experienced an injury from the neurotoxins that you were exposed to and all the pesticides and sarin and all the other things going on at the time that your immune system had to respond to. And in 1 person in 3, not everybody, a chronic antibody production happened that was attacking tissue and maintaining inflammation. And that's a perfectly reasonable way to understand the importance of autoantibodies in Gulf War illness, not just in MS or in myasthenia gravis. So I think it's relevant to everybody. We have one study that we had to put on hold because of COVID, where we are actually doing an aggressive immunosuppression of the antibody producing cells and seeing if we can cure Gulf War illness by using the same kind of therapies they're using in MS and in myasthenia gravis to stop these kind of antibody production. So again, I went off the question to answer a broader question, but I think that MS very well could have been a result of the injury, the brain injury that happened during the Gulf. And absolutely, I've seen Gulf War veterans, well-defined Gulf War veterans that went on to develop MS. So that's definitely true. I've also seen MS patients who were never diagnosed as Gulf War illness, who have received their service-connected status from their Gulf War deployment. Now that usually does take a lot of fighting because, as you know, getting service-connected often involves having to go back more than once and come back with more expertise to make the argument. But I have seen the veteran service organizations that help Gulf War veterans do this brilliantly. One of the presumptives in Gulf War illness is neurologic injury. So it can be done.
Okay, actually our next question is also for Dr. Klimas. I am a US Navy veteran who served in Desert Shield, Desert Storm, living in Sydney, Australia. Is there any links between Gulf War illness and type 1 diabetes? So Dr. Klimas.
Time is it in Sydney right now? Thank you for being here. I'm trying to do the math, but whatever it is, it can't be a good time of day for you. Thank you for joining us. And thank you for your service. That's a harder link to make because we don't know yet. So here's the deal. 1 person in 3 at about the age of Gulf War veterans is going to have a type 2, not type 1 diabetes, type 2 diabetes. So diabetes is not uncommon in the population. And so one of the questions we've been trying to answer is it more common in Gulf War illness? And we don't know that yet. We're still trying to figure that out. It's going to be kind of a tough one to prove. But type 1 diabetes, back we go to autoimmunity. Type 1 is an autoimmune disease. It's not insulin resistance, it's autoimmunity. And we do know that Gulf War veterans have this high prevalence for autoimmune disorders. Now, I haven't seen a lot of type 1 in the Gulf War vets that I have cared for, but I don't think anyone's done a study to answer your question. So guess what? You have to take our survey because that's exactly what the survey is for. We're trying to find out the survey that Liz talked about at the beginning. It's serving 2 purposes. One is we're starting that survey to learn about what does Gulf War look like right now in your life? How are you now? What kind of symptoms do you have? How severely are you affected? What are your comorbid conditions like type 1 diabetes? Because we don't even know how to count it unless we can get thousands of people to answer our survey. But the other thing this survey is doing for us is giving us an ability to go back and ask additional questions. So if we found 50 vets with type 1 diabetes, you know, we could go back to the 50 of you and see if we can discern a pattern to see why that happened. And I will be, you know, just flat out, we're using that survey also to recruit people into our studies, because we can save you a lot of hassle and really help our success in getting there much, much faster if we can find the people who are study eligible right at the beginning of a study. The CoQ10 study that we referred to early on, an easy peasy study. Oh my God, what an easy study to be in. We are in our 3rd year and we didn't fully recruit it. It's just ridiculous that we couldn't find 200 veterans willing to take CoQ10. And now it's too late. We got to finish with what we got. But all these new studies we want to do, the single biggest barrier to us being successful and getting this stuff out to you is finding enough volunteers to be in the studies and doing it efficiently and quickly. With these virtual studies that we're talking about, if we found a couple hundred people that were willing to be in a study, we could start them all on the intervention in a month or 2 and be finished with a study in 6 months instead of dragging it out 4 and 5 years. Imagine what that means. I could put something on the formulary at the VA in a year from now instead of 6 years from now. That's important. So it's really, really important for all of us as advocates, and I include me and all of you as advocates, that we talk to each other and really try to let the veterans know of the Gulf War that when they're participating in research, this is right in there with leave no man behind. This is take care of your fellow vets, get it done. Don't leave these people suffering another decade because we couldn't find enough people for our studies. So help us every way you can, get the word out.
Okay, the next question. Has anyone on an aircraft carrier have Gulf War illness?
Oh, I can answer that. Yes, absolutely, yes. Because you were exposed to a lot of the same stuff. You might not have been in the ground, but the oil fires blew over you. The sarin gas clouds blew over you. You got the vaccines. You had a lot of the same exposures. And many of you that were on the aircraft carriers and and in the Navy in general, sometimes had to actually go to shore. And there you were exposed to additional toxins.
Okay, the next question is comes from Jonathan. I'm a Gulf War veteran who was diagnosed with vestibular migraines in 2002. Is this a common symptom of Gulf War illness?
I get to answer all the questions.
Yeah, well,
it's cool. Migraines are incredibly common in Gulf War. Vestibular and others, the migraines are very common. That's because underneath it all, there's a complicated thing going on where the immune system is being inflammatory, the endocrine system sending out weird signals that aren't exactly correct, and then the brain that regulates your blood pressure and your pulse, the autonomic nervous system, is doing all kinds of weird signaling, what puts you on a big seesaw of adrenaline and the parasympathetic, sympathetic adrenaline and the opposite, and that triggers migraines. So this instead of a gentle little balance of the things that regulate your blood pressure and the intensity of your vessels contracting, they're spasming, and that causes migraines.
Bill, do you have another question for us?
Yes, the question is for Dr. Klimas. Which organization did you reference to help with the claim for MG autoimmune?
Oh gosh, there's a bunch. And Marilyn, you're on the chat room. Can you respond to that for us in the chat? That would be really helpful. Marilyn Harris is in the chat room, and she's leads one of the veteran service organizations in Texas. But there's a number of them, including the National Gulf War. Oh, come on, help me with this one, Bill. The National Gulf War.
Not the registry, right? The
no. Shoot, I'm just blocking the name. I'm so sorry. I'll tell you, I'll put it in the chat room. I'll look it up for you. Okay. Oh, great. Marilyn, thank you for saying I'm here. Can you type into the chat room for everyone to see what I mean by a veteran service organization helping with a claim? I don't know. Can you let her talk? Is that possible, or not? because she's a participant. I don't think you can do it on the Zoom. So if you can type it in, then I can read it out.
Yeah, and if she could also type it into the chat section and
That's
make
where
it
she is
available
right
to
now.
everybody. Okay,
She's
that's
in the
perfect.
chat right now and she's available for everybody. So if you have a way to say, how does someone get help from a VSO for a claim from the VA for service connection? That would be super helpful.
That's perfect. And a couple of you are asking about the link and how to get in touch with us. To Zena, put the link for it's for the redcap.nova.edu survey. If you take that survey, what it does is it gives us your information. It allows us to contact you if you give us permission, and we can reach out to you on an individual basis and give you more specific information. Also on that link is our email address, if you didn't get it earlier, and our direct phone numbers for both Precious and Zena, so you can contact them at any time.
Next screen, please. And so Elizabeth, again, was talking about earlier about our team. And so these are our team members and some pictures of some of our team members doing different events. Aren't we a awesome looking group?
We are a very awesome looking group, but I just want to end my portion of it by saying I'm incredibly grateful to be part of this research and to be working with veterans on a daily basis. I feel like incredibly fortunate, and I think that working with you, I've learned so much about ways that we can make your lives better. And it just takes all of us being a community and listening to each other to make research better. And I know times are a little bit scary right now, especially with COVID, but we are here. We are in our homes. We are on the computers. We're on our phones, and we are here for you at any time. So please reach out to us with any questions. If you know a veteran who was not here today and would like some more information, please pass our information. We are more than happy to take your calls and answer any questions. And from the bottom of my heart, thank you so much for your service. And I'll pass it on to Bill, who's gonna send us off.
Wait, I got one interruption because I have an answer for VSOs. Denise Nichols, hey Denise, thank you for being on. Suggested for people with neuromuscular that they also consider the Paralyzed Veterans Association, that they've been very helpful. But your local VSO, your local Veteran Service Organization, is the first place to start. Go ahead, I'm sorry. Go ahead.
No problem, Dr. Klamas. Precious or Elizabeth, just a couple of quick things to close out. There's several questions that have not been answered. Are you guys able to go in and answer these later? Number one, and also will this video of today be somewhere on a website so people can go back and view it? That has been two of the questions.
We're recording this video so Sarah can post it for us on the INM Facebook page. So this video will be made available to anybody who wants to see it. Also, we can stay on and answer any questions that we might have. And again, if our phone number, if we didn't get to your question, please feel free to phone us or email us your question, and we'll definitely get to them. But we're going to try to answer everything we can before we end today.
All righty. So with that being said, I want to thank all the attendees for taking the time out of your day to attend the webinar, and thank you to our speakers.